gather people after this ketamine lecture that was randomly happening at the Karolinska Institute. So I asked the people from the university if we could have a room to discuss the lecture afterwards, and they booked the room for us. And then that was a bit of a white lie, of course, because the Facebook event was called Psychedelic Research, What's Happening in Sweden, or something like that. And we had 17 people come to this meeting, and people were very enthusiastic to do something. And I think in that first meeting, most of the original board of NPV was present. We organized a couple of screenings, and I don't know if we did a lecture in the early days, but we did some meetings basically, and every time new people showed up, and it felt like there was a momentum, like a natural momentum to it. So we decided to start an association, mainly so that we could have a budget and invite speakers. We wanted to invite Robin Carhart-Harris, and back in 2016 he wasn't a big star yet, so he said yes, and
he was cheap.
Yeah, he actually stayed in one of our apartments. He was fine with not staying in a hotel, which was super cool.
Yeah.
But we did this lecture at Karolinska Institute, and a lot of people showed up, and then we decided to just keep doing lectures. So the sort of the foundation of NPV has been bringing people together, both in open events, open lectures, and also member events like seminars and stuff.
It sounds very similar to the story of Psykedelisk Samfund. That was also in the beginning. There was a group. I was not in the original group, but we the organization made some lectures, and especially in 2017 we had a symposium, Psykedelisk Symposium, and we also had Robin Carhart-Harris and a lot of the guys from Imperial College, and they were really cool guys. So I think that's also been the core thing with Psykedelisk Samfund. But I think my impression, and I'm curious to hear about what is your perspective on this, is in Denmark, our society, our psychedelic society, also has like a sort of, you call it a social focus, where we're not entirely focused on just lectures and just science, whereas NPV is like the Network for Psychedelic Science. So are you a community organization, or are you like mostly a scientific academic organization?
It's a good question. My personal opinion is that I have always tried to create a community around psychedelic science. We have been very clear from the start that that the organization only focuses on the science, because it makes it easier to collaborate with researchers. But at the same time, it is a community of students, students who want to write a thesis and find a a supervisor, for example, and so I would say it is a research focused community organization. We have had in the past like pub nights, for example, which is not a research focused activity by any means, but we still in those meetings we still talk about science and talk about the association and what's going on in the association.
Yeah, okay. I think here in Denmark, we also have, I mean, for a couple of years, we've arranged something around Bicycle Day or International Mushroom Day. And often we would have a lecture, but there was, I think my observation from the Psychedelic Symposium in 2017 was that a lot of people came. There was like mostly scientific lectures, but a lot of people came and they tried to follow, but they weren't really in academia. Like they just came because it had to do with psychedelics and it seemed interesting and they were just genuinely curious. So
I think because there isn't a psychedelic society in Sweden, a lot of people who are just interested in psychedelics come to NPV events as well. And some of them get really into the science, and some of them feel like it's not really their style or their thing.
And so we also have a fairly newly started organization in Denmark called something very analogous, Netværk for psykedelisk forskning. So meaning the Network for Psychedelic Research. So they're really leaning into the academic side, which from Psykedelisk Samfunds perspective, sort of, I guess, frees us up a little bit to be a little bit more inclusive to non-scientists. And then we also in the autumn of last year, there was a group of people who got together to found a group called Netværk for Psykedelisk Terapi or Medicin, meaning the Network for Psychedelisk Therapy and Medicine. And Rebecca is a representative of this organization, which sort of branched out of Psykedelisk Samfunds. So that's a network of mainly psychologists, psychotherapists, and also sort of people professionally interested in the psychedelic scene, also coaches, counselors, and underground facilitators. I think that's something that I'm excited to see, that people can talk from a professional perspective. So I'm not sure if you do you have, like, you're a psychologist, so can I ask you your and I guess Rebecca will, maybe you want to take over and ask about sort of the act of providing psychology integration support, for example.
Yeah.
Sorry,
yeah, I would like to do that.
Words.
Yeah, sure.
Yeah.
But I was just, if I can finish that question, perhaps.
Okay,
so
please.
How do the psychologist and the psychotherapist, do they have any sort of professional, do you a place where you can meet and talk professionally with underground facilitators, for instance? Do you have any sort of communication channel with the people working underground in a professional manner? No,
I don't know any underground facilitators.
Do you know if they're
honestly? I know of ayahuasca providers, but people ask me all the time if I can recommend them an underground psilocybin or MDMA facilitator, and my honest answer is I don't know. If I did know, I still wouldn't give it to them because it would be an ethical problem for me as a psychologist. But yeah, I have heard that there are people doing it in Sweden. There must be, but I think it's deeply underground. Okay. I know of more Danish underground facilitators than I know of Swedish ones.
Okay,
interesting.
So do you see it as is it more taboo in Sweden, or is it like really, really underground? So people don't. They don't advertise about it, or it's not known to anybody, because here in Denmark you will have different websites or through Facebook, or it's out there, you can find it. but I don't know if it's the same thing in Sweden. Do you know if it's yeah? Are there? Would you be able to find somebody by Googling, or do you have to know somebody to know somebody? All right.
Yeah, I'm curious about this sort of I mean to ask you about the political and cultural environment in Sweden regarding psychedelics, because I think in the beginning of Psykedelisk Samfund, we also, like, to avoid as much stigma as possible, we would lean as much as we could into like the scientific rigor of things, which I think is a very good strategy, and I think the scientific approach is really important, but I think there's also been a gradual softening, like in the public discourse. Then people have started to talk more about psychedelics. It seems to be getting less and less taboo. Like just today, I was in a radio program, like a talk show, trying to be a little bit edgy. It's called Radio Loud. I can post a link somewhere, probably on the Facebook page. And we were talking pretty openly about psychedelics. So there's been a shift in the last couple of years, I feel. But I'm wondering about how is it in Sweden? Is it just something that you should never admit personally to having taken psychedelics? Like, you have to be sort of very professional about it and, you know, claim to be purely academically curious?
I have admitted to psychedelic use already back in 2018, but I don't talk about it a lot, and I never go into details. I don't. It's people don't do it. I think so. I think people are still worried that it will create problems for them. But I think that we are really past that stage now.
And
but I think
how do you see that?
Just the way that it's talked about in the media, and how people seem to be less scared and more curious. I'm starting a podcast.
Okay.
Which will be called, the working name is Min Resa, or My Trip, and it will be stories of people's experiences with a focus, of course, on the integration and the sort of psychological developmental process. And lots of people have gotten in touch and want to be on the podcast, so that's really cool.
Cool. So as a psychologist, you say you sort of came out of the psychedelic closet in 2018. Did you experience a backlash? Did people take you less seriously, or I also assume some people were supportive? What was your experience sort of coming out, as it were?
It was not a big thing. I was interviewed in the Swedish Psychologist magazine about psychedelic science, because we were doing a conference then, and I mentioned that they asked, I think, and I mentioned that I've had ayahuasca, but that I didn't want to go into detail. But they printed that, and nobody's really mentioned it.
You also did co-found the Network for Psychedelic Science, so maybe people will make assumptions.
I don't think anyone was surprised. No.
I feel the same way. I also have very long dreadlocks to sort of tip people off.
Working as a psychologist, have you been working with integrational therapy for a long time, or is it something new that you do?
I'm fairly new at it. I've had the practice for a year or so, and I don't have that many clients, although it's picking up now. Now I'm seeing about 3 to 4 people every week, but until recently, I worked almost full time in the regular healthcare system.
Mhm.
So I didn't really put any time or effort into the integration work.
Hmm. Well, tell us a bit about how this works. How do people find you, and what do you offer? So what is it that you do in these kinds of sessions?
So I think people mainly find me through my media participation, and also through the Network for Psychedelic Science. They might Google. I mean, my website, or I should say our website, because it's me and Johan Eriksson, who's also a co-founder of NPV. Our website is the only website in Swedish that explicitly says that we see people and we talk about their psychedelic experiences. I have established a network of integration therapists in Sweden. We're about 30 people, but
Wow.
they don't write on their websites that they are doing it.
Okay, so that's kind of from mouth to mouth, or that how do they get clients?
It's different for each therapist, I think.
Okay.
But so I see clients on Fridays, and a lot of people I just see once or twice, because they want information or they want an assessment. Maybe they're going to a retreat and want some guidance, or they have psychological problems, and they want to know more about psychedelics. And some people I see for a long time, just like regular therapy, but informed by my knowledge of psychedelics and their psychedelic experiences. So I work from in a sort of in the spirit of harm reduction. I don't tell my clients what to do or what not to do. I just provide information based on science and empathic understanding and validation. I'm very inspired by Elizabeth Nielsen and Ingmar Gorman's work. We've had a correspondence for a few years, and we had them give a course as well in Sweden a couple of years ago. And they sort of come from the Center of Optimal Living in New York, which is a harm reduction psychotherapy center run by a guy called Andrew Tatarsky, who developed harm reduction psychotherapy, which is originally developed for alcohol and drug abuse, but it's really nicely adapted to psychedelic integration work, and they've recently published an article on it just a few weeks ago that sort of sums up the approach. PHRI, psychedelic harm reduction and integration. So yeah, a lot of the clients that I see, they want to have psychedelic therapy, or they want to a referral to an ayahuasca retreat or things like that, and I don't do that because it would be problematic from an ethical standpoint. I would have to accept some kind of responsibility for their experience if I did that, and it's just simpler to not do it. But if clients are like thinking of going to different retreats in Holland, for example, they can send me links to the website, or we can discuss the different retreats, and I can give them my opinion on what is good practice and what is perhaps worse practice.
So this is the sort of screening that you do, and so you inform them and tell them about what they can expect? And do you also talk to them about, do you screen them for the different psychological issues that they can have, like their mental stability, or what do you do to kind of assess whether it is a healthy thing for them to do? Do you help them in that process, or do you keep it up, make them have that decision about whether they're mentally fit for that journey?
I do that.
I'm sorry, it's just a delay. I'm sorry. Keep going.
I make that assessment, and I always ask about history of drug use and predisposition to psychosis and things like that. And then they're of course free to. I can tell people that I think you should avoid this, at least at this point in time. I think there are other avenues that you might explore, like like meditation or physical exercise or breath work, perhaps more safe, less extreme altered states of consciousness. And then, of course, if they still want to go to an ayahuasca retreat, I'm there to support them. I mean, not actually there, but before and after. Much like you would approach a person using heroin or any other drug.
Okay. And so you say that most of the people that you get come for this sort of preparation work before they go to a ceremony or a retreat or whatever they do, but some of them come back for the integration work afterwards.
Yeah, I think I have. I haven't really counted, but it feels like I have maybe 50-50 people who come before a psychedelic experience and 50 people who come after.
Okay. And so what do you do when they come back? What methods do you use when they have had an experience and you say, okay, let's use this therapeutically?
Yeah, well, it differs a lot between different clients, but generally I would say that I approach it in a very non-directive way, so that I let them speak and only ask open questions, and try to refrain from making a lot of interpretations or judgments, even though someone might say that they have a very horrible experience or a very ecstatic experience. Of course I have thoughts coming up in my head like, oh, that's good, should explore that. I try to refrain from that, at least in the first few sessions afterwards. And then I try to connect connect the experience and the things that come up afterwards. I try to connect that with their intention and whatever things they might have been struggling with before, be it a psychological disorder or just issues. So it's sort of a common exploration.
And what do you feel that this approach can do that regular therapy can't, or do you see that there is any difference in it? What is your experience about the different methods that we have as psychologists or psychotherapists, in our backpack of methods and theories? What can this do?
Well, I don't see it as a therapy or even a technique. I see it as just a sort of attitude that these experiences are important, so they should be they should be included in therapy. So I think what this really adds to any therapeutic approach is this amazing therapeutic material that is otherwise hidden. It seems like such a waste of time to or not waste of time, but I mean it's
you get down
such a waste to not talk about these experiences.
Mm-hmm.
Right.
Do you have a feeling that you can reach the client faster when they have these experiences that they come and bring into the therapy room, that we get down into the muck quicker than with other methods? Or what is your take on that?
Yeah, I mean, on a very basic level, admitting to drug use with a therapist is like an act of vulnerability. So just the fact that you're talking to someone about something that they keep secret from, maybe from their family, it's quite intimate.
Mm-hmm.
So I feel like you get pretty deep pretty fast.
Is it something, do you experience that the clients that come to you keep it, that you're one of the only people who knows about it, that they don't talk about it with friends or with families?
It's rare that someone comes to me and says, I haven't discussed this with anyone, but mm-hmm. it's quite common that someone says like, I have keeping this a secret for a long time, and last week I told my best friend, and now I'm telling you.
Yeah, all right.
And my parents don't know, and my partner doesn't know. And so a lot of in those cases, I think opening up to your loved ones is a really important part of integration. Mm-hmm. Mm-hmm. I mean, I don't think it's really possible to get far if you keep it a secret from your partner, for example. But I don't tell people that out loud. Do you
recommend them? Okay. So you don't recommend them going out and saying you through the integration. You don't say, well, think we should work up to the point where you come out of the closet and tell people the deep experiences that you had. And
I think I definitely have that opinion, but I try to not be so upfront with it. But I always ask about it, and I think most people can probably make the connection that I would recommend that. But I generally try to get them to say it first.
Yeah, I guess also when people come to you, they are in an active therapeutic process. So maybe I think it's nice to keep things a little bit simple. I guess in a way it's very nice to have a therapeutic alliance with a psychologist such as yourself, so that you have a space to talk with about these kinds of things. Because if you're trying to explore something that has therapeutic material, then I guess it's you might give the impression that you are somehow in trouble or off on the deep end. Whereas like if it's a process that uncovered a lot of childhood trauma or some repressed emotions, but then you did work through it, you can afterwards you can talk about it in a relatively relaxed manner that might put people more at ease than if you really sort of there can be a lot of loneliness in having these experiences, these active processes, and nobody to really turn to.
Yeah,
and a lot of shame.
And I've been thinking about this, about the community knowing, or you've some parents or friends or lovers or whoever, and because I heard a podcast not that long ago where was a talk between Dr. Rosalind Watts and
François
Boisa. And Dr. Rosalind Watts was talking about how the psilocybin that they see now a comeback of the depression, of the symptoms of depression, even though they had a long period without it. And they have had to start this a group for the patients who were in these trials, where they can talk about their experiences, because they feel so isolated, not having anybody to share these experiences with. And it is a very profound thing for them to have somebody to share it with. So I was just thinking about that when you talked about it, having clients coming there and perhaps not having anybody to talk to about what they have experienced besides their therapists, and perhaps one person, a friend or something. Do you see that with the people that both with colleagues, but also people just who've tried psychedelics, that there is also some healing and integration work in when you talk with people who've had that experience? Or what is your take on that?
Definitely. I think a community is so important for integration, and I think that's something that a lot of my clients really seek, and like a lot of people seek a community in general. Not necessarily a community to share psychedelic experiences, but I think it's very important. And I used to do integration circles before COVID. I know that you have a very active integration community in Denmark, and I was actually inspired by that. And I hope to be starting up again later this spring. But I think integration circles have the power to be as effective or even more effective than individual talk therapy or talk integration therapy. Of course, they have to be well facilitated, and it has to be really a safe space and all that. But yeah.
Yes, it's been, I've hosted a few integration circles, and I also see Magnus in the chat, who is a facilitator in the Copenhagen integration community, is saying hi.
Yeah,
hi, Magnus.
Thanks for the support, Magnus.
Nice. I'm not I have an idea, and maybe I'm just imagining things, but have you been involved in making harm reduction spaces in, for example, Borderland, this regional Burning Man event, or have you made psychedelic care intervention somehow?
Yeah, I've run the sanctuary at the Borderland, and before it was called the sanctuary, it was called the Exit, which isn't it's not a specifically a psychedelic harm reduction space. It's more of an emotional support space, which also has first aid. So it does a lot more than just psychedelic harm reduction. But I did always use the Zendo project manual, and I also did a Zendo project training in California, and I've been doing that, and it's amazing. That was sort of my ticket into the burner community. You know how when a lot of people come to the burn, they ask themselves, well, how the fuck am I going to fit in here? And for me, it was like, well, I'm a psychologist. I can take care of people.
Frontier psychologist.
Yeah, and I've learned so much. I think I've learned more important things during the sanctuary than I did during my university years. It's like it's hands-on stuff.
Yeah. Do you feel like sharing? Maybe it's confidential, but of course curious to what you've learned.
Well, just how to be with someone in distress, and how to sort of radiate this, how to be a calming presence without necessarily doing so much. And also like managing volunteers and teaching. I've done a lot of workshops with all the volunteers, and I also had supervisors under me. So I coached the supervisors and sort of taught this approach, which is really informed by psychedelic psychotherapy and developed by people affiliated with MAPS. So it's been very valuable to me.
Yeah, I also have some experience from Cosmic Care at Boom Festival in Portugal, where like I think I had some romantic ideas about trip sitting, where people would come in existential distress, and I would hold their hand while they would realize that they were one with everything. But in reality, people came like in very, very different states. Like one guy was just completely stiff for support, and we just put him down, and he sort of melted after a while. And another guy was super bouncy on ketamine, and there was a very high spectrum of states, and people would come in. So,
is that your experience as well?
Yeah. And a lot of, I mean, I also volunteered with the Zendo project at Burning Man, and I think I sat with like 5 or so people in my 2 shifts, and none of them was tripping. Some of them had taken psychedelics earlier in the day, but they had other issues that just required, like, they needed support. But I think that like the Zendo approach or the psychedelic harm reduction approach, it's good for so much more than just psychedelics. It should be used in psychiatry, dealing with schizophrenic people.
Okay, and tell us a bit more about that. Why or how? How do you see it working?
Because I think in both, now maybe some psychiatrists would disagree with me here, but in a psychedelic trip, let's say in a bad trip or in a psychotic state, there are some like disturbing perceptual stuff going on, right? There's crazy shit happening, and that can be scary. But a lot of the distress that those people are in is just a fear about all the stuff that's going on. And if you can just calm them down, a psychotic person can be calmed down and still be psychotic, but not in anxiety. And then there might actually be things to learn from that state. I believe that psychosis, it's extremely poorly understood, and there are a multitude of different states that we just label them psychosis. But I think, at least for a lot of people with psychosis, they're going through a crisis that they need to move through, just like in the third principle of psychedelic harm reduction. Move through,
Which
not
is
down.
Yeah. So what is your first response to this? So how do you calm them down when this anxiety or fear grips them?
It's again different in different situations, but it begins with myself. Am I calm? How am I breathing? What kind of thoughts and feelings am I having? Can I calm myself down? And then I guess not necessarily. I mean, for sometimes it's good to talk, and sometimes it's good to be silent. I would say it's important to match, to bring my own state within closer to the other person's state. Mm-hmm. So, but still in a more desirable place. So, like, move closer to where the client is, but not all the way. It's a little bit like with kids. I don't know how it's called in Danish, but in English either. But in Swedish, it's lågaffektivt bemötande. And it means low affect relating, maybe. Mm-hmm. So if someone's very angry, I try to meet them in that emotion, but more calmly and in a lower affect.
It's funny you say, because what I'm thinking about when you started talking about this is fornærmeste udvikling. What would it be in English? The stone for the near proximity of development. So you try to hit that space, like you say, which is where you have a room around them. You can navigate a little bit to the left or a little bit to right or a little bit up and down, but you can't. So you have to lead them from one place to the next. So it's like a stepping stone, right? So that's what I hear about this, taking them by the hand and slowly taking them down the ladder of fear, or what you would call it. Is that?
Yeah, it's like facilitating change.
Like that?
Creating a safe space for change.
Mm-hmm. And so what do you do after you've calmed them down and you can see, okay, now the fear is slowly dissipating more? They're not in a state of fear anymore, but they're still in a state of being in a psychotic state. So, because I heard you saying there's a lot to learn from that state, that altered state. So what do you do when they're in a place where they can actually learn something because they're not gripped with fear?
Well, I want to start by contradicting myself a little bit. Because it's not necessarily it's not necessarily the process or the path to calm someone down.
Okay.
It might be necessary because now you're in a space with other people, but sometimes if someone acts in a certain way, it's because they need to act in that way, because that is the process. And by trying to calm someone down can sometimes be like, giving a person on psychedelics and antipsychotic. You can interrupt something that you need to again move through.
And also, I think in my understanding, sorry to butt in, but I think you don't want to give the person the impression that what they are experiencing is wrong, like that they're allowed to be angry or allowed to be afraid. So you're not trying to, in a way, shut it down. I think that could happen, but I think it might also interrupt the process for people to sit and contain themselves rather than actually moving through. So I like what you said also, that it starts in you, like, so somebody comes in and they're in a state of distress, and you some people might be overwhelmed, and what do you call it, an able trip sitter would be able to remain centered, but I guess that's an art form. Do you have some tips and tricks or suggestions for how do you train people to stay grounded and centered in dramatic situations?
It's very difficult because we all lose our ability to think clearly when we get distressed. But breathing is very important. So doing breathing exercises. So one thing that we did at the sanctuary last year, or the last year that it was, so in 2019, was that when volunteers go on start their shift, they get a handover from someone who's leaving their shift, and I gave everyone instructions, and there were printed instructions as well in laminated A4 sheets that, like, you are going to go away from the sanctuary and you're going to sit down on the ground and you're going to look each other in the eyes, and you're going to take 3 deep breaths together, and then you're going to check in. And then the person who's leaving their shift can say something about how it was and wish them good luck. And so I think one trick is to really try and stay centered all the time when on shift, when on duty, and try to tap into each other's centeredness, and have that group support, because then it's easier to maintain that when shit hits the fan.
Okay, that's an interesting perspective. You're trying to maintain like a group energy that's sort of calm and centered. In 19, was this, I think I was in Borderland that year, was it the little, like, I remember one year where the sanctuary was this sort of NATO tent. It was the like bright lights and a little bit, I would feel comfortable in there if I had my arm blown off from a grenade. And then in 19, I think it was this very cozy tea house situation, right?
Yeah,
I thought
the sacred
there was
tea
a
house.
marked improvement. Yes, the sacred tea house. That was amazing. Yeah, I really liked it. I came in at some point and I was not actually tripping, but it's a burn. I was plenty stimulated, as it were. So just to sit down and I think read a little bit in a book, and somebody came with a cup of tea, and it was really nice. So thank you for your role in making that happen. That really benefits the entire collective space of this festival, or not a festival, it's a burning thing. So yeah. One question we did have in the chat, and we already did touch on, like, okay, so you are saying that in some cases people experiencing a psychosocial process of, some call it a spiritual emergence, and it's really hard to discern from a full-on psychosis. So what is your perspective on this? Like, when is something spiritual emergence? When is it psychosis, or is it a either or a spectrum, or how do you think?
I really don't know. I don't have a lot of experience working with psychotic patients, and also not with spiritual emergence. Yeah, I don't know that I can. I would be on. I could speculate, but I would be on thin ice. Yeah. But I do agree with the question that a lot of times they get confused, and that it's really important to separate them.
Yeah. So is in like a sanctuary psychedelic care situation, if somebody is it seems like experiencing psychosis, there is some point where we say, okay, now we have to call somebody will come and take them away to a facility where they will take care of these things. And you're of course trying to avoid this as much as possible, but there is a line. What do you think that line is?
At the sanctuary, we would always be careful with not making difficult calls. So we would be quite possibly set if it seems like if a person is behaving in a pretty extreme way, we send them off to the psychiatric unit because really we don't have the skills and the authority to deal with that stuff. Knowing well that it might not be the best place for them. But yeah,
it's a really hard call in. When I was in college, there was a lot of collaboration with sort of the health, mental health services, and it was always us like if we cannot guarantee safety, like either our own safety or their own safety or the safety of other people in the space, then we would just have to shift it on. But we also did have a psychiatric nurse that was associated with in the team, so that they could actually give antipsychotic medication, and they did that a few times. So I think that I was really impressed with the cosmic care, and that seems to be next level to also have a collaboration with a psychiatric nurse or a medical doctor or something. That would be great. But like even just a tea house, like a calm space, the sacred tea house, I think is a really, really important and great addition. So I hope that we can collaborate across the pond to try and set up some of these initiatives. We have something brewing in Denmark, but let's talk more about that.
Yeah,
it'd be great to
I'm really passionate about psychedelic harm reduction, as you can hear. I also need to make the distinction that psychedelic harm reduction is not something that NPV does, since the organization is entirely focused on science. I have been wanting to start an organization for that, and I have encouraged many people to do it, but it hasn't really materialized. So, but I've also organized psychedelic harm reduction or emotional support spaces in other festivals in Sweden. Actual festivals, not burns. Where they also have medical personnel, and it's always really interesting that collaboration and that dialogue.
Yeah. So we have a little half hour, and let's open up the space for questions from the other participants. We have one from Anders Tingman, who's also in the Network for Psychedelic Therapy and Medicine. Anders, do you want to ask the question yourself, or can we ask it for you?
Det er fint. I would like to ask it myself if you can hear me. Hi, yes. Filip.
Hi, I can hear you, but I can't see you.
Okay.
The
video is on here.
Yeah, it's I'm spotlighted and Rebecca and Martin are spotlighted.
Sorry.
Oh,
right.
Here you are.
Okay, I'll remove the spotlight then. Oh, God damn it.
Okay.
Zoom. Sorry. Right. Hey, Anders.
Hi, Filip.
There you go.
I just wondered, how do you see the different potential therapeutic potential of the psilocybin and MDMA? For different kind of problems, and how do you envision that they can be integrated in mental health? They are quite different, as you know. My own take is that maybe MDMA would be easier to use for a lot of things. And also, do you have MDMA research in Sweden?
So I'll start with the second question. There's no MDMA research in Sweden, but there is a very promising project. There's a foundation called WONSA, which stands for World of No Sexual Abuse, and the founder of this foundation and clinic, because it is a clinic treating women who suffer, or people who suffer from trauma related to sexual abuse. She's very keen on starting a study, and hopefully with the help of Osmond Foundation and MAPS, that might materialize. But it's very early days still. Okay. So to your first question, the difference between MDMA and psilocybin in therapy, it's a very big question. I feel like, of course, I have an opinion. I think they have different pros and cons, and might work different for not only for different kinds of problems, but also psychological traits. Really, I believe that it might be better for some personality types with the one or the other. I think of course a big difference is that MDMA doesn't dissolve the ego or dissolve the sense of self in the same way, and that has some important implications. Perhaps it limits the scope of MDMA a little bit. It doesn't have that spiritual, existential dimension. It doesn't have the same potential to make us question known truths or assumptions about the world in the same way. Although many people who've had profound experiences of MDMA might disagree. But I mean, generally speaking, it's not. It's an easier process, both for the therapist and the patient. So I agree with you that it is easier to work with, but I think both are needed. They're like different tools, to use a cliche word, but I believe that in psychedelic psychotherapy, that both MDMA and psilocybin should be available and maybe tried in different stages with the same patient. It might be that doing an MDMA session first would increase the efficacy of a psilocybin session, or the other way around. You know,
it's interesting talking about combining the two.
Also known as hippie flipping.
Oh, I meant on separate occasions.
Yeah. I did too, but in a whole process. And if you had like a long, 12 sessions, that instead of only having one of them could be, the fourth time would be MDMA, and the eighth time would be psilocybin or something like that. I don't know if there's a lot to talk about that.
I have clients that use psilocybin and MDMA in different points in their therapeutic process. And that makes a lot of sense. And some people start with MDMA because they don't have any psychedelic experience, so just to know what a non-ordinary state is. But others also find out that maybe it's too overwhelming, or maybe it's more like they need to get more like the social dimension. Maybe they get a little socially ungrounded, or actually MDMA can also be used for integration for some people. Rick Dublin is also talking about that. But we will see what comes. But I know there are some underground therapists that are starting to work with psilocybin and MDMA on the same session, and apparently there are some people I think it's a very good combination, and also I heard Rick Dublin talk about this, and there are also a little research right now about combining. I think maybe it's LSD and MDMA, or maybe it's psilocybin and MDMA. I think it's in Switzerland. But
also known as candy flipping.
Sorry. But it's also starting to develop as a therapeutic method, I think, or it's research. But thank you for the question. I will just
with MDMA. Yeah. I have a question. So I think it makes sense to me. It's just my internet connection is unstable. I hope I'm going through okay. I'll just press on. But it makes sense to me why MDMA is a really interesting adjunct to psychotherapy, because you can have a connection. You will feel a lot of trust. You will feel safe. You will access your emotions. So in this psychotherapeutic space, then it seems obviously like it's a very potent tool. Whereas, I mean, from a psychology or from in a therapeutical trajectory, sort of what is the indication where it's like, not that you can necessarily recommend somebody to go and take psilocybin or go on a ceremony or get a guided session, but what are like the primary indications? Like, okay, now then you start thinking about psilocybin assisted therapy particularly.
I don't know. I mean, I don't. I never recommend anyone to use anything. Of course, I have ideas. I used to work in a pain rehabilitation clinic see patients with chronic pain, and their mental flexibility is so limited by the experience of chronic pain. And we work with acceptance and commitment therapy, trying to work with psychological flexibility in various ways. And it just even though ACT is supposed to be the best most evidence-based therapy for chronic pain, it just seems like they are stuck. So with a lot of chronic pain patients, I fantasize about psychedelic therapy.
And people in sort of end of life situations, terminal patients, that's where they have a lot of positive results, as I understand it.
Yeah, when it's really, I haven't had anyone close to me die of old age or existential in a terminal illness in many years. But whenever a friend tells me about it, then I'm very heartbroken. And I always recommend the movie A New Understanding about the Johns Hopkins research with existential distress.
A new understanding. Interesting.
It's on YouTube.
We have a question from. It's on YouTube. Nice. We have a question from Magnus. Magnus,
yes.
Are you right? Yes.
Thank you, Martin, and Rebecca and Philip, all of you, for bringing light to all of these important subjects. And my question is regarding that, actually. And I came in a bit late, so sorry if it's been talked about already. But I'm wondering about kind of the temperature in Sweden. First of all, with therapists, what is the stance of the therapists that you know, and how is the discussion? Are people for or against psychedelic therapy in general? And on the other hand, in the government, is there any talk of decriminalization or legalization or anything in the political spaces?
So are you primarily asking about like attitude use in society, or more related to psychedelic research?
More about the therapists themselves. If they are curious, if they're asking questions, if they know about it, are they for or against?
I'm in a bubble of people who are interested in psychedelics, and it feels like this bubble is getting bigger and bigger. So I don't think that I'm representative, or even have a representative view on these matters. But my impression is that therapists are increasingly curious, and that the stigma is also disappearing. In Sweden, there's a Facebook group for only psychologists, with like certified psychologists. It's got about 8,000 members. And
you're dropping out a little bit, Philip.
There. Am I breaking up?
Maybe it was us, actually. Please continue. Sorry.
I've been posting about psychedelic science, and there's also a psychologist who's also a cannabis researcher, and he's been posting about cannabis for years. And there used to be no likes and no comments, and now there's, or like some judgmental comments, and now it's like that group has very much changed. So I think that in the sort of psychologist therapist community, that there's a lot of openness, and there's also a lot of disillusion with the current state of psychiatry, and everyone agrees that we definitely need some new stuff here. So I think people working in healthcare are generally quite receptive to new ideas, but on a political level, on a parliament level, it's really a standstill. Like it feels like they are not living in the real world. The Swedish, so more and more like official bodies are asking the government to evaluate the Swedish drug policy, and they're not calling for decriminalization or not anything. They're just calling for an evaluation of the Swedish drug policy, since we criminalized drug use since 1988. And now that, like, the United Nations have said that the Swedish drug policy is violating human rights, and now the Swedish Folkhälsomyndigheten has recommended that the government evaluates the current drug policy, and the minister in charge is saying, no, we will not do that.
Wow. But are you reading up on what's happening in Norway? Because it seems that they are starting to think seriously about changing some of these laws. I haven't really read up on the details, but maybe if you have, you can share what's going on in Norway.
I know that they made the decision to decriminalize all drugs, and they haven't done it yet. It's not in effect yet. So it's still like they are figuring out exactly how to do it.
That's really interesting.
Yes, in the end of this segment, we will have a link where you can see how to seek a Norwegian citizenship. So for everyone, anyone interested.
Yeah. Our next question is from Alexander. Alexander has a podcast.
Can I just say that I can only see myself right now?
You can only see yourself. Okay, we're going to remove your spotlight then. Bing. There we go.
I can see you.
Nice. Okay, Alexander,
yes.
Please come forth.
Hi. Thank you so much for this. It's awesome. So my question is about experience, like the therapist experience. So when you're working with integration, do you think it's important to have psychedelic experience as a therapist? Is it a benefit, or can you be as effective without the experience? My feeling is that in some of the deeper psychedelic work, experiential understanding could be pretty beneficial and important. So I was just wondering if you have any thoughts on that.
So you're asking about integration work, yeah?
Yeah.
I think that having experience of altered states of consciousness is more important when you're doing actual psychedelic psychotherapy. With integration work, I believe that everyone can do it, and I want to teach all therapists and all clinicians how to do it. So I don't think it's as important. I think an open mind and a curiosity, or beginner's mind, as they say, takes you a long way. I believe that it can be very comforting and validating for a client to know that their therapist has some experience of the stuff that they have gone through. And yeah, I see benefits of having psychedelic experiences as a integration therapist. Also, I think it's important to, in order to be not so freaked out by the experiences of the client. I think it brings a lot of understanding.
Thank you.
So yeah,
So I have
good,
a question.
but not necessary.
Yeah. That's a good answer. I think it's nice to distinguish between sort of like the acute phase and the support in the preparation of the integration phase. But I'm wondering, we have a fair bit of not so many psychiatrists, but psychologists, psychotherapists, and other forms of therapists who are interested in kind of getting into the field of psychedelic therapy, like somewhere in the environment, maybe supporting in integration or preparation, or maybe even in actually doing the session. So if you want to become qualified in this field, like how would you recommend people to move forward?
There are so many courses popping up now, and it's really difficult to say which ones have good quality and which ones are just a ripoff. I believe that the two sort of organizations that I trust the most are Fluence, or Fluence 8, which is run by Elizabeth Nielsen and Ingmar Gorman. They're quite expensive, their courses, but I think they are really the best. And then there's also Psychedelic Support, and the website is psychedelic.support, which is run by Alison Fiduccio and some other MAPS affiliated people, and they have some courses, and I think they are good as well. I can't really vouch for any other actors in the field.
Yeah, and there are many actors. I've seen Synthesis Institute. I've also seen Mind Foundation, and then there's all these online programs. So it's really an emerging market. So I hope we can follow along because it seems like to be a very important thing to build this set of competencies.
Yeah, I think before long we'll have guides and reviews about different courses and educations. Right now, all of this has appeared during COVID as well. Like it's like nobody has anything to do, so they just set up an online course and charge a shitload of money for it.
I've been thinking actually
business idea.
I've been thinking about putting together an online course of like introduction to psychonautics 101. So I feel personally attacked.
Kevin, how is this first?
We have a question. We have two questions. Yes. So Kevin, would you like to ask it in person?
Yeah. Hey. Thank you guys for organizing this, and thank you, Philip, for joining. Good to see you again. So I would very much like to drift a bit on this, what you said about integration circles and these kind of community circles playing a big part in integrating these experiences, because I feel like a lot of the people I meet find that it's actually being engaged in the community and the developmental process that goes on in being engaged in the community that gives a lot of punch to the integration, right? But this is something that is being completely left out of research. And when I talk to doctors, what they want next in research is to give people more doses, right? Like, okay, we would like to, instead of giving them one psilocybin session, we would like to give them 2 or 3, because that's the way you do as a doctor, right? And psychologists, they want to give therapy afterwards. That's what you do. So there's really not a lot of attention being paid to maybe educating the community at large, right? Or prepping a culture where people can actually talk to their families about this experience, or talk to their co-workers or their social counselors and so on, right? It's not really, and the information that is reaching these parts of society is basically filtered through the media, which is a very reductive kind of filtering that is going on there, right? Like, okay, science shows us this, and okay, hippies, you know? So how do you see this maturation process of the public? Is there any way to amplify this? Is it going fast enough compared to how fast people are actually catching up on the therapeutic potential? What do we do?
Good question. Not sure where to begin. I agree with you, and I've also been frustrated with the lack of research on group therapy, because it seems like such low-hanging fruit. I mean, people have been doing group ceremonies for centuries, and now when I talk to researchers about it, they say like, yeah, but it's so hard to do a high-powered group therapy study. It's much easier to get significant results with individual therapy. So it's some academic bullshit, if you ask me. Related to the publish or perish paradigm, like, yeah, you need to get your stuff published in a high achieving academic journal, otherwise it's not valid. But anyway, Yeah, I think therapeutic communities are super important, and I think what we can sort of hope for, or what I'm hoping for, is more safe and more safe spaces for group integration work, which may involve group administration as well. I think in not too many years, when psilocybin and/or MDMA gets legal in some way, I hope to have more psychedelic retreats that function as a sort of community which is sort of always running, and where there's always people living and taking care of each other. Yeah, I don't know what to add.
Thank you. That's perfect.
What do you think about that answer?
Yeah, I think it's a process where there's a lot of thinking going on and maybe not a lot of action happening quickly enough, because there's so much focus and so much money being funneled into research and the communication of this research, which is basically very limited, extremely limited here compared to what is actually, like, how ingrained these substances have been in traditions and communities everywhere else. Here it's like, okay, we can administer it through a doctor and we can give some integration with a therapist. And it's like, if people can't talk to their families, their co-workers, their friends, and so on, the integration is not really going to happen. So until people in general, I feel, have an idea of what this experience actually has to do with. Yeah,
I think I know that it's a key point of Rosalind Watts. Her observation was running these studies that, like, something that was really important was that when if they had a WhatsApp group among the participants in the study, then they really would use each other and support each other in the ongoing process. And I think this interview between François Boissat and Rosalind Watts was really interesting in this regard, because they talk about this community aspect, which I also agree is one of the sort of, there's a major shadow in this paradigm where one person goes to a therapist and works on himself, but there are aspects that aren't really included here, which is all the community aspect. So I think that's very curious. It is now 8 p.m. So, like, this is our scheduled time to stop. I do have one more question from Vegard and also myself, that if unless people are in a hurry, then I would like to ask a final question and then we'll round off. Is that okay? Yeah. Okay. So, like, on the NPV web Facebook page, I saw an article which I thought was really interesting. I'll try and see. I'm not sure if it's legible here, but it's a paper that's a meta-analysis of 14 different studies using mainly psilocybin and also a little bit of LSD, and they would see, like, what are the psychological indicators that it would be either like a mystical experience or that they would have adverse effects. So I think it's been one of these things that you don't know if you're going to have a good experience or a bad experience. It's a little bit like rolling the dice. But earlier you also said, talking about MDMA and psilocybin, that, like, one of the other medicine it sort of depends on people's. The topic I'm trying to open is, like, what psychological indicators would would indicate that you would have a sort of mystical experience, or you would have a bad experience?
Well, it says in the article, so so it's like I can say what's in the article, or I can say what's not in the article.
Well, I'm sitting.
That
Like,
wouldn't
maybe
be correct.
Okay. Yeah. Sorry. So I guess I'm setting you up here, but I have the article in my hand, so it's easier for me to just say what's in the article. And what I would like from you as a psychologist is to maybe explain to me, like from a psychological perspective, what are we actually talking about, right?
Yeah.
So they have, so that they have, roughly speaking, they separate experience into sort of mystical effects and adverse effects, and like in some might call the adverse effects like the stereotypical bad trip, or the mystical effects could be some sort of ego dissolution or feeling of cosmic love, or all these nice things. So then they analyzed people's psychology somehow, and they found that if you are high in absorption, openness, acceptance, and surrender, you're likely to have a sort of a positive, sort of mystical experience. What does that mean? Like, can you translate for us what kind of person has high absorption, openness, acceptance, and surrender?
Well, I mean, to me, openness is it's a personality trait, but it has been shown to involve more psychological material coming into consciousness from the unconscious, which is good for creativity, for example, but it's also connected to psychosis, because if we cannot deal with all the stuff that is coming into to our consciousness, then everything just gets really chaotic. So in terms of psychedelics, I guess a person who is high in openness is used to dealing with a lot of information coming in, and is perhaps not as fearful when stuff starts coming, because the filter or the veil is not so tight to begin with, so the shock is not as intense. That's my interpretation of it. So it's easier for a person who's high in openness to let go, and letting go is really what is associated with a mystical experience. I'm speculating a little bit here, but I think I'm on a right track. And the adverse experience, or the adverse reactions, is really associated to holding on to things, trying to hold on to like the ordinary mind state, or to avoid stuff that comes up, or that stuff that comes in to the consciousness. So yeah, that's my spontaneous reaction to it.
Yeah, thanks for that. So I guess that's one side. And I also know that the psychedelics have been in some study shown to actually cause shifts in trait openness, which is pretty remarkable. So and it makes sense to me. Like, I took this psychology, like the Big Five personality test, and I actually am slightly low in openness. Like, I'm high in intelligence, but I'm not that high to openness to experience. So maybe that's why I actually personally benefited a lot from being opened up a little bit. But I can also see like how if somebody is very low in openness, then to open the floodgates will be sort of a little bit too much on the system. So it's very interesting. Then we also see they say that in this study that people who are prone to adverse effects are usually people high in preoccupation, apprehension, and confusion.
The state.
Which makes the state, and it kind of makes sense to me. I understand the words, but probably it means something in particular. Do you feel like elaborating on what kind of person might be imagined to have a bad experience?
Well, I think the things you just mentioned are actually states. So it's like the current state that the person is bringing into the session, and that may or may not be correlated with the trait, so their personality.
So states and traits, like I'm in a state of confusion, but I'm not confused as a character. Right. Okay.
Yeah,
so
I think highly confused people are systematically excluded from psychedelic research. But I guess someone high in neuroticism, that the trait neuroticism is more likely to be preoccupied. And so more likely to have an adverse event. At the same time, that adverse event might be exactly what the person needs to work with. So it's more. It's a tricky question, really.
It's a very tricky question,
because the adverse events are what happens sort of before the breakthrough. So it could be also formulated as like the people who are preoccupied in the beginning of the session, they don't make it past the holding on stage. They don't make it to the let go stage. So they don't make it through the process. They stay in a fearful state, in the holding on state. So maybe what they needed was more preparation, or more trust in the therapist, or a higher dose.
Yeah, that's and also preoccupation. In a way, we're talking about in a way setting here. Like if you are preoccupied, maybe you should take a little bit more time to clear up your life so that you can go into a journey. If you're apprehensive, maybe like if there's not sufficient trust, then that doesn't put you in the best situation. And if you are in a way confused, then maybe like you can have a dose of psilocybin and then you'll be tripping and confused. So I guess it folds into the classic terminology of setting here, but now they made a nice graph and put some numbers on it, so that's nice of them.
I think it's a great article.
So we're going on.
I think it's very valuable for future research.
Yes,
because
and
like it says in the
reactions to psychedelic drugs. Yeah, like it says in the
now. It's I think to people who have psychedelic experiences and are sort of used to psychedelic experiences, this does not come as a great surprise. But we really need the knowledge to reach outside this bubble that we are all in here. We need all the researchers that are that don't have psychedelic experiences or a lot of knowledge, but maybe are curious because of the research. We want to guide them into making good choices.
Yes. That's great. I agree. And I'm already a little bit over time. Do we have any concluding remarks? Anybody have some burning words of encouragement somewhere? Alexander says, thank you so much. What a wonderful way to spend a Thursday evening. Thank you, Alex. We're very happy that you all chose to spend some of your Thursday evening with us. Thanks a lot, Filip, for showing up. It was really nice to have this conversation. And thanks to Rebecca for hosting us in her lovely
my office.
Your office. Yes. She takes clients. You can find her if you're in desperate need of integration psychology. Then you can find her on psykologerne.dk. Is it correct?
That is correct.
You can find Filip on his website. What is the name of your website again?
Psykedelisk-integration.se.
Psykedelisk-integration.se. Amazing. It's been a collaboration between Psykedelisk Samfund and Netværket for Psykedelisk Terapi and Medicin. And of course, Filip is representative of Nätverket for Psykedelisk Vetenskap. Remember, okay, so yeah, a little last announcement is that we have Bicycle Day coming up. You're not invited as a very purely academic institution, but of course, the April 1943 was the day when Albert Hofmann discovered LSD by intentionally taking 250 micrograms of that substance and seeing what happened. And that's been it's now a sort of like a psychedelic special, like a psychedelic holiday in the community. And we will, in Psykedelisk Samfund, we will invite our members to join us for I want to say field trip, but I'm worried about giving people the wrong assumptions. We will take our bicycles, we will go to the forest, and of course it's just a picnic. Whatever our members will do is up to themselves to take with forest, and you should check out our website, psykedelisk-samfund.dk. That's it. I don't have anything more to add. Would you like to?
Me either. Well, just by the concluding remark that Filip, it was so nice to have you here, and I hope that we can keep on talking also about the field of integration work. I would love to just keep expanding on the collaboration between Sweden and Norway and Denmark, that we can work together and to increase awareness and help each other as colleagues in this work with harm reduction and integrational work. Yeah.
Yes, yeah, especially harm reduction. I think that would be super great. It's already happening with Borderland. But I'm interested from our perspective in Psykedelisk Samfund, and then there's also it's maybe not happening under our flag, but there definitely should be a Scandinavian entity that would become very good at providing psychedelic care about you. Yeah. Any last words before we round off here?
Just very happy to be here. It's been fun.
Yeah. Thank you so much. I think that concludes today. Thank you so much, everyone. Bye-bye.
Bye.